So my name's Jodie Reynolds. I'm a lymphedema physiotherapist at County's Manukau District Health Board, and I also do private work in Auckland. Now, I've been specialised in lymphedema, for over 10 years now. I still think I'm about 21, but I'm not. In County's Manukau District Health Board, we are actually the biggest lymphedema clinic in New Zealand, and there's two of us. Which is quite worrying, considering I came from Wales and I was part of a 14-therapist team, so it's been quite a shock coming here. Also, we're the only service in New Zealand that is actually dedicated to lymphedema. Most other services do a dual role, so most people are actually physiotherapists and they do 50-50, so the musculoskeletal role and a lymphedema role. So currently in counties, we have over 1,200 patients, and that's just for the two of us. So we work extremely hard, and I am actually really proud of the work that we do. We run a risk awareness program. So we see every lady or gentleman that undergoes breast cancer surgery that has lymph nodes removed, and that's irrelevant whether it's one lymph node or all your lymph nodes. And we do a full assessment, so we do a range of movement, we do scar management, we release axillary web syndrome or cording. We also dabble in bra advice as well. We do lots of things. We use bioimpedance in counties. I mean, the ideal scenario would be to see every patient before their surgery, but unfortunately we don't have the luxury of that. We usually see people from 8 to 10 weeks plus after their surgery. The other thing, it sounds probably like I'm making excuses, but we only had one bioimpedance unit, and although we're 2 therapists, we're actually 3 therapists, but with 0.5 FTE. So actually sharing a machine around 3 of us is quite impossible. And also we work in a lot of satellite clinics, so we literally can't just carry everything with us. So, and as Louise said, the use of the bioimpedance machine is invaluable, really. It's so useful for, as she said, that early detection. But we're very thorough. We spend a lot of time educating the breast cancer ladies, because one of the problems that people think that they have lymphedema is usually due to the nerve being cut, so you have that sensation of swelling. I always compare it to going to the dentist. So those of you that had injections to numb your face feels out here, but actually when you touch it, it's not. So we spend a lot of time making sure that people are aware of nerve sensation problems, and also the common mistake that we also get from patients is usually from a mastectomy when they get a dog ear left over and they think that's fluid, but it's not. And also as well, the other common thing is after a mastectomy, a lot of people think they've got lymphedema over their stomach. Sorry, I do laugh at this. But usually, because especially if you're big busted, you don't usually see underneath your boobs. But unfortunately, that's always been there, and that's not lymphedema. I always feel very harsh when I have to break that news to patients. So it's very important that we actually weigh people as well, because usually through the cancer journey, people actually put weight on because they're out of their normal routine. So so hopefully we do a lot of education with our patients, and we actually keep them for a year and a half. And we also have an open referral system. So although we discharge them if they haven't got any clinical signs of lymphedema, they can always contact us at any time after discharge. And we work very closely with our breast cancer nurses in counties, and I will say we've got an awesome relationship with each other. So lymphedema care in New Zealand does vary, and that's only because it's underfunded, I'm afraid. I was quite shocked at how many lone practitioners there are. And that actually frightens me because lymphedema can be quite complicated. And as Louise said, she's got a tool, because if you treat everybody the same way, you're not going to get very far. Lymphedema always surprises me, and you just have to be on your toes and always thinking outside the box to treat. So the lymphedema care does vary within New Zealand. At counties, I would say we offer the full spectrum, apart from laser therapy, and that's just because of funding. Also, the other thing that actually restricts us probably using a bioimpedance, and it's a terrible thing to say, but it always comes down to money. You know, sometimes our managers say, well, you know, you've ordered electrodes, but do you want these garments as well? And, you know, you do have to make these decisions all the time, you know. So usually we will go for money for garments because we want to treat the people that have got lymphedema as well. How am I doing for time? Sorry, it seems 5 minutes, I'm going to cram everything in and go talk really fast and not breathe. So there's a really useful website in New Zealand called lymphedema.nz.org.nz. And that has the list of private and public therapists in New Zealand. So that will also give the information about referrals as well. At counties, I think we are the only team that actually take referrals from patients if it's appropriate. All the others have to come from a GP or nurse. I think I've covered everything, really. Yeah. Can you just give that website again? Oh, yes. So that's lymphedema, nz.org.nz. Yeah. Okay.
That's fantastic. Thank you very much, Jodie.